Yat and welcome to 4 Directions of Wellness. I'm Roberta Diswood. Twopahanischle, Sisakani Bashachin, Nakaidene Deshache Hanani Deshanelle. Prenatal care is the health care you get while you are pregnant. It is really important to schedule your first prenatal appointment as soon as you think you are pregnant. Today our guest is Ariel Ali Jumbo. Ariel is the supervisory nurse at Northern Navajo Medical Center Pediatric and Women's Health Clinic. Thank you, Ariel, for being here. Can you go ahead and introduce yourself?
Yes, thank you for having me. Yat Ariel Ali Jumbo Yinishye, Bilagana Nishle, Maedeshkijni Bashashchin, Bilagana Deshache, Deschini Dashanale. Thanks for having me.
Well, thank you again for being here. As I said in the introduction, when someone thinks they are pregnant, they should schedule their first prenatal appointment right away. Why is it important to see a healthcare provider as early as possible?
We want to be able to support our patients throughout their entire pregnancy. We want to check on the health of the mother and baby, determine how far along somebody is in their pregnancy. We also want to help patients learn how to give baby the healthiest start possible. Also, we want to be able to spot any health concerns early on so that we can help treat those or manage them throughout the pregnancy. We want to prevent any complications from arising if at all possible. We want patients also to be able to ask questions as early as possible and ask those questions throughout their pregnancy. We also want to be able to start a referral for specialized care if they need anything that we can't provide here at Northern Navajo.
Okay. And so when a person comes in for their first visit, what can they expect?
Yeah, the first visit is a big visit. We tend to do a lot of things right up front. So they should expect a pregnancy test, of course, calculating their due dates to see how far along their pregnancy is, discuss their medical history, complete a physical exam, which would include things like a height, their weight, blood pressure check, several blood tests, several urine tests, and then just lots of education about what to expect in pregnancy and all the things that they need to do for their home care.
Okay, that's good. So if an expecting mother needs special care, which you've mentioned, what is provided here at Northern Navajo Medical Center?
Yeah, so outside of our routine prenatal care, we have actually a specialty clinic that's called Special Care Prenatal Clinic for any patients who have a variety of circumstances. So some examples of patients who might need to come to our specialty clinic are those who have a diabetes of any sort. So if they had diabetes before pregnancy or develop diabetes in pregnancy, they would come to that clinic. Someone who has high blood pressure, they might have complicated medications that need kind of extra attention. Somebody who has preeclampsia, somebody who has twins would probably need extra monitoring as well. And sometimes we have people come to that clinic who've had multiple pregnancies in the past, or people who are over 35 years old and might have some other complications going on that just, again, need extra attention. And there are a variety of situations that come up kind of unexpectedly that need more monitoring of both mom and baby. So that's kind of a case-by-case basis, though. We would just determine throughout the pregnancy if somebody needed that higher level of care.
Okay, all right, that's good. And before we end the show, we wanted to go over some of the pregnancy warning signs. Like what are the symptoms and what should a person do if they have any of these warning signs?
Yeah, great question. There are a lot of reasons that somebody would seek prenatal care outside of their routine visits. So unresolved headaches, so a headache that does not go away with just taking plain Tylenol or resting. It's a persistent headache that doesn't go away. They should come in right away for that. Any dizziness or blurred vision, changes in their vision, any fevers, again, that are unresolved by taking Tylenol, swelling that is abnormal for the patient. So it's normal to have a little bit of swelling in pregnancy, of course, especially in the lower legs, but swelling in other parts of the body or swelling that does not go away with rest, we would want to check on that. And then any harmful thoughts about themselves or their babies. Extreme tiredness. So if somebody just feels like they are fatigued all the time, they can't kind of do their normal day-to-day activities, we should see them for that. The big things, of course, are trouble breathing, chest pain, bleeding in pregnancy. Those are obviously emergencies. We would not want somebody to come in right away for those. But then a few other things that are a little harder to say for sure if you should come in. We want to talk to you about it the very minimum. So nausea and vomiting that affects somebody's daily life. It's normal to have some nausea and vomiting in early pregnancy, but if it persists for a long time or somebody just feels like they can't do their day-to-day activities because of the nausea and vomiting, we would want them to come in for that. And then belly pain. So if somebody feels like they might be in labor or they're having pain that just doesn't go away, that would be a reason they would need to come in, of course. And then if baby is moving less or they don't feel baby moving at all, they need to come in immediately.
Okay. All right. Well, that's some really good information. I want to thank you, Ariel, for coming in and sharing all of this. But before we leave, we want to make sure that we give our patients the important contact information. So if you want to share that.
Sure, I'd be happy to. We want to remind patients to call as soon as they think they are pregnant to schedule their first prenatal appointment. Appointments at Northern Navajo Medical Center are offered Monday through Friday from 8 a.m. to 4 p.m. And the number to our women's health clinic is 505-368-6500. If they have a primary care provider that they want to see, they can also be seen in the family medicine clinic at 505-368-6632. If a patient has an emergency or concerns with their pregnancy and are less than 20 weeks, so less than halfway through their pregnancy, they can be seen at the emergency department. That number is 505-368-6600. If they are past 20 weeks, they need to call labor and delivery at 505-368-6900 or go to the unit downstairs.
Thank you. I want to thank you again for being here. This has been 4 Directions of Wellness. Hagonet.